I had the test done, I had the biopsies done, and the worst thing often is dealing with the wait, where you're sitting there thinking, do I have cancer, don't I have cancer? And I just had this feeling of doom. I thought, I'm gonna have cancer. I walk in, he walks in with his associate. Now I'm thinking, okay, this isn't Publishers Clearinghouse and I've won the prize. So I'd had 12 samples done for the biopsy. And he was a good salesman, I guess. He said, Tim, 11 of the biopsies were clean, great. Unfortunately, the last one, you have cancer. When you first hear those words, it takes your mind a bit to actually catch up to what you've just heard, because it's something that supposedly everyone else is supposed to have. You don't think about those things or whatever it is. And one of the first things I thought is, wow, at some point in time, I'm gonna die. So you certainly think a little bit about the finite nature of life. So I had a choice to be made whether I was gonna have radiation or surgery done. And really, the trade-offs to it are is what you're willing to put up with in regards to side effects. I decided to go with radiation.
The prostate's really just part of the male reproductive organ, and it produces a fluid that's in the semen that really allows men to create ejaculate for procreation. And that's really its main function. The location of the prostate is in a position where it's surrounding the urethra right below your bladder. And so if the prostate is growing, or if there's problems with the prostate, it can affect the urethra. And so it's kind of like if you are urinating and the tube is a lot smaller because the prostate's growing, you have problems with your flow, or you're peeing at night, and you're not emptying well. The urinary symptoms are really just because of the location of the prostate. All men get older, the prostate gets bigger. And that's why younger men usually aren't having prostate issues. And so as men get older, the prostate gets bigger. It sort of affects the urethra, and that's what causes the urinary symptoms. What causes it to go bad is really somewhat genetics. Now, sometimes people won't have a big prostate, but still will have urinary symptoms. So it gets complex, kind of, because people can have issues with their prostate, but not have prostate cancer. When a gentleman is first diagnosed with prostate cancer, it does depend on their Gleason score, which gives you an idea of how aggressive it is. And then based on that, you can decide whether someone would do nothing, because active surveillance is something we try to do for a lot of our men with low-grade cancer. So active surveillance is one option, surgery is one option, and radiation is one option. There are other things, but the sort of mainstays of therapy right now are surgery or radiation. Chemotherapy doesn't play much of a role unless the cancer has spread outside and is metastatic. The Da Vinci robotic system was a pretty amazing advance for urology in particular, because where the prostate is located is deep in the pelvis. It's hard to get our hands down there, and it's also very difficult to sort of operate in that field. With the Da Vinci, we're able to get down there with small instruments, and we're able to do very careful dissections with those instruments in order to get the best results. There's less pain with the Da Vinci robot because there's smaller incisions, and one of the most important things is that there's less blood loss.
Prostate cancer is a very common cancer, and when a person is diagnosed with prostate cancer, they see either a surgeon or a radiation oncologist. Then the patient will make a decision based on control and survival and side effects. So some patients in their mind will want to have their prostate out. And we're finding more and more patients are having radiation to treat their prostate cancers, because the chance of curing your prostate cancer with surgery or radiation is the same. If a person picks radiation, there's two types of radiation they could have. One is radiation from the outside, which is an X-ray machine that has a very high-powered X-ray that can focus on the prostate and direct the beam to the prostate and spare the surrounding tissues. Our whole intent is to deliver this high dose of radiation to the target, to the tumor, and our machines are able to do that very effectively with our team behind the machines, which is created by physicists and radiation planners and the therapists, nurses, and the physician. And we do that It's a daily treatment, but patients are doing very well. They go to work, they do their usual activities, their energy is good, and then they're done with treatment and their side effects go away very quickly.
If I believe in this, I really should put my money where my mouth is in regards to it. If I believe that, you know, one of my roles on this planet is to make this community a better place, the place I love, then what better to do this? So full circle, we came up with Real Men Get Tested. The most pure gift is the gift you give to somebody that you don't even know and they can't say thank you. And I think in some way, as we go through this campaign, somebody out there, some way, we're going to connect with, and it's going to make a profound difference in their life. I found people around here who've had cancer I didn't even know about, and they talked to me about it, and you know, it's kind of it's a little club that you never wanted to join, but boy, I'm in pretty good company. So that's what we're doing.
I got tested.
I got tested, diagnosed, and cured. Take the pledge.
I got tested. Take the pledge.
Early detection could save your life. Get tested today for many more tomorrows.
I got tested. Don't wait till it's too late. Get tested today.
Hey, Oneida County, I got tested. You should too. Go to the website and take the pledge.
I was an idiot until I got tested. Get tested. Take the pledge.
Come on, guys. Get tested. It's no big deal. If not for yourself, do it for your loved ones. I did.